I am doing my care plan on a pseudoaneurysm of the left femoral artery, and my patient was a 74-year-old male who came in weighing about 70 kilograms. His blood pressure was 88/60, pulse was 80, respiration 16, temperature 98.1. His current medical problem when he came in was right hip pain, low blood pressure, and O2 stat level. Patient recently had a cardiac catheterization surgery on both femoral arteries. Past medical history given at report was as he had aortic stents, right above knee amputation, AFib, hyperlipidemia, chronic pain, pulmonary edema, peripheral vascular disease, COPD, osteoarthritis. Client was a 57-year-old smoker, and he's been smoke-free for 3 years. And the pathophys of a pseudoaneurysm is considered a false aneurysm, and the vessels occur when blood vessel wall is injured, and then the leaking blood collects in the surrounding tissue. This may be due to the complication of the cardiac catheterization that he recently had. The blood will leak and it gathers outside the artery. And then right now he's just on medication. We had to hold off on Eliquis while he was in Med Surg because he was supposed to go to surgery, but he ended up not going to surgery. And he was on bupropion that could help with depression and quitting smoking. He was on famotidine, simvastatin, and gabapentin. And the gabapentin could just be he had amputation and he could just have that phantom pain. And he had his CMPs done and his CBCs. His glucose was kind of high at 154. Everything else was within normal limits. Sodium was low at 133. Potassium 3.2 was low. And his RBCs were low at 3.58. And the patient is slight on the scale for sodium potassium, and it could just be due to the lack of movement client is experiencing. And then the client's oxygen level has been down and could count for the low RBC count. And with his CBCs, his highs were the neutrophils. Neutrophils was 86%, and then his absolute neutrophils were 12.11, and that could just be caused to the inflammation he had after surgery. And his lows were hemoglobin and hematocrit, and those could just be due to the low level of oxygen that he's having, and it's not getting enough of the red blood cells. His O2 stats were about 88, 86, and he was on 3 liters of oxygen, so he's not getting the oxygen that he needs. And right now he had a chest x-ray because he was coughing, and there was just some chronic scarring versus some mild pulmonary edema. And he had ultrasounds of his groin right in here, and he also had a CT done. They found that there was no pseudoaneurysm on the right side, but on the left side there was. And the left groin, it was 1.6 centimeters by 1.4 centimeters by 3.1 centimeters. And there's consistent flow, so they're okay with him going like that and not getting any surgery because he's still getting that adequate flow. With his contrast, the same thing happened. It's coming off the left common carotid artery. The bifurcation measurements, they had it at 1.2 centimeters by 1.3 centimeters by 1 centimeter. And with the CT pelvis contrast, there's just soft tissue swelling. And with all of this happening, my nursing diagnosis, the first one, I put ineffective peripheral tissue perfusion related to a drop in blood pressure and being bedridden, as evidenced by blood pressure 88/60, and then no mobility due to femoral surgery and bedridden. The rationales and interventions I put here. For this nursing diagnosis, I put assess for signs of decreased tissue perfusion, and that could just be elevating for a baseline. Get an order for labs when taking anticoags. When they start putting him on the Eliquis, that will help to gauge the organ perfusion and function. Patient sitting up more in bed, this could help him get more oxygen. Instead of laying down, he could be sitting up and getting all that oxygen through him. Patient will receive, the family will go get the prosthetic leg so he can start walking around, getting out of bed, moving. Get respiratory involved to help him breathe through the incentive spirometer. Keep him on a pulse ox, monitor his oxygen level, especially since he's in like 88, 86 with 3 liters of oxygen. Submit patient to diagnostic testing, get an angiogram, make sure that he is getting flow so that oxygen can keep going through. Recommend foot and ankle exercises just because he needs to get the vessels, blood flowing back to his heart and prevent pooling. Measure the cap refill just to determine adequacy of systemic circulation. And then administer fluids, electrolytes, and nutrients to promote optimal blood flow, organ perfusion, and function. And right now, with the desired outcome, I'm going to have it as demonstrate that he is able to get out of bed and starting to take a few steps with prosthetic leg and walker by the end of the day. Understand before discharge that he will continue to have pain and poor tissue perfusion if he does not keep moving. So they were not met due to time constraints, so I wasn't able to get those done. The nursing diagnosis number 2 was chronic pain related to AAA and AKA, as evidenced by AKA prosthetic leg and bedridden after surgery on Tuesday and being in severe pain. We can evaluate his coping response to pain, and this will help him have a self-management of awareness of what he needs for his pain. Then get physical therapy involved so he can just get out of bed and get off that hip that's hurting him so much. Have patients start to sit up more in bed so he's ready to start moving. Have the patient's family retrieve the prosthetic leg to start moving around. And use a cold pack instead of pain meds. That will help with pain as well. Alert to changes in pain characteristics so we can see if there's a new physical problem happening. And then encourage the family to assist in home care interventions, and that could be just massage or anything like that. Recommend the patient take breaks when he's working, when he's exercising, just so he can get re-energized and start moving around again. Keep the walker within reach so he's able to get up and get out of bed so he's not just laying down all the time, and that chronic pain could just be from that. And review safe use of analgesics for home management. So these analgesics will help him manage the pain and hope he understands why they're being used. And my desired outcome was by the end of the day, patient will walk with prosthetic leg and walker to help with the ischial tuberosity pain. And that was partially met because his wife went to get the prosthetic leg and he was starting to walk, but I already left for the day, so I wasn't able to see if he actually did. So kind of partially met. And the second one I had was patient will cooperate with the pain management and rehabilitation program during and after release from Med Surg. It was not met due to time constraints. Nursing diagnosis 3 was sleep deprivation related to the chronic pain as evidenced by severe pain upon admission to ED and then after surgery on Tuesday. And we need to evaluate his sleep patterns just to help us understand how he sleeps. Evaluate medication regimen for products affecting sleep to help him recover and rest so he can start exercising the next day. Get the patient to sit up more so he can get ready to move around. Try getting a massage therapist for him if he wants to do that, just because it'll help loosen all those muscles and maybe the chronic pain won't be, well, it'll kind of help it, but it won't alleviate it. And then keep a sleep-wake log to see when he sleeps and when he's awake, just so we can know why he isn't able to sleep. And recommend maybe a light bedtime snack and a warm glass of milk. It'll help you get sleepy. Promote exercise 3 hours before bedtime, just so he has that energy and he kind of feels fatigued where he wants to sleep at nighttime. Recommend patient take melatonin when released. It's a natural way to sleep and maybe it could help him. We could also try some relaxing music just to help him relax. The same way, review safe use of analgesics for pain, just so if he's on acetaminophen, he can take it and his pain can subside when he's able to sleep. The desired outcome was patient will take medication towards bedtime and possibly use a sleep aid to help with sleep and report it in the morning. That was not met due to time constraints. And then by discharge, client will identify individual appropriate interventions to promote sleep. That was not met due to time constraints. So this is my pseudoaneurysm of the left femoral artery. And now I will show you the diagnostic testing that I had, his vital signs, pictures, medications, pathophys, CBCs. Here were my desired outcomes and evaluations. Nursing diagnose 1, nursing diagnose 2, nursing diagnose 3.